Ischemic heart disease is basically a condition whereby there is reduced blood supply to the heart muscle. It comprises of stable angina pectoris and acute coronary syndromes. Let's look at stable angina pectoris. There's a pain or discomfort that occurs in the front of the chest and may radiate to the neck, shoulders, jaw, or arms. The chest pain is typically induced by exertion or emotional stress and relieved by rest or glycerol trinitrate. Individuals who experience stable angina pectoris are at high risk of developing acute coronary syndromes or a heart attack. Risk factors include diabetes mellitus, hypertension, cigarette smoking, plasma lipid abnormalities, obesity, family history of heart disease, and persistently elevated markers of inflammation such as C-reactive protein. So risk factors for this condition include obesity, diabetes mellitus, hypertension, smoking, and hyperlipidemia. So the main causes are atherosclerosis with narrowing of the coronary blood vessels, and also spasms of the coronary arteries. Symptoms are central or precordial chest pain. This may radiate to the left arm, neck, or jaw. It's relieved by rest and also by glycerol trinitrate. The signs that are usually elicited, surprisingly, there are usually none. Okay, for investigations, 12 lead ECG is required. Cardiac enzymes, creatinine kinase, MB, CKMB, and troponin, and also blood glucose, blood lipid profile, FBC as full blood count, chest X-ray, stress ECG, echocardiography, and also coronary angiography. For the treatment, the main treatment objectives are to minimize symptoms, to prevent progression to acute coronary syndromes, to identify and manage modifiable risk factors, and also to improve the quality of life. Non-pharmacological treatments are educating and reassuring the patient, and healthy lifestyle modifications such as diet, exercise, weight management, reduction in alcohol consumption, avoiding or quitting smoking. Pharmacological treatment for treating acute chest pain, he gave glycerol trinitrate sublingual 500 micrograms that then as required you add aspirin oral 300 milligrams that then 75 milligrams daily, or you can give clopidogrel oral 300 milligrams that and then 75 milligrams daily, and also you add atenolol oral 50 to 100 milligrams daily, or bisoprolol oral 5 to 10 milligrams daily, or you can even give metoprolol oral 50 to 100 milligrams 8 to 12 hourly. Avoid beta blockers in bronchial asthma, in bradycardia, and also hypertension, and avoid atenolol in heart failure. You could also give verapamil oral 80 to 120 milligrams 8 hourly, but avoid in bradycardia, hypertension, and patients already on beta blockers. So optimize or initiate treatment for hypertension. and also for diabetes mellitus, and use statins to treat abnormal blood lipids to target levels. If beta blockers or verapamil are contraindicated, you give it's also bide dinitrate oral. That's 10 milligrams. So you give it 8 to 12 hourly. So referral criteria: refer the following patients. So those with no significant improvement in symptoms after the initial treatment, and also those with worsening risk factors. Let's look at the common flow chart. So when patient presents with angina pectoris, you assess risk factors, investigations, ECG, FVC, FBS, lipid profile, uric acid, and then you give aspirin 75 milligrams daily, modification of risk factors, and also anti-anginal medication. And then from there, adequate control of symptoms, control the symptoms adequately, and also you control the risk factors. Review 6 months, assess symptoms and risk factors. If there's worsening of symptoms or even the risk factors, then refer to cardiologist or a physician specialist. Or if there are no significant improvements of symptoms, you also refer to a cardiologist or physician specialist.